Hello everybody, in this video we will speak about the cycle of change. And in Bach flower therapy, the successful treatment equals to a change. And if somebody comes to you, for example, that he wants to get rid of his headache, but he doesn't want to change anything in his life, so the Bach flower therapy probably isn't suitable for him, and another treatment like usual painkillers may be more suitable. And significant changes usually do not go in a linear way, but they go in a cycle. First of all, the patient has some confidence in his abilities, in the success, or in the therapy if you treat him. And then some motivation comes, and this motivation starts the attempt to make a change, and the patient may do some investment prior to the attempt, and then this investment often influences the success of the attempt and or failure, and the result of the change or of the attempt influences back the confidence. So let's take an example of Jane, a middle-aged woman that has a fear of driving, and instead of her husband drives usually, but one day she has to drive because the husband is away, and her confidence in her driving abilities is very low, and the motivation is negative. She is just forced into driving. So she doesn't make any preparation, any investments. She just takes the children and sits into the car, and the whole driving is very painful for her. She's terrified, and her panic grows. And finally, her trip ends by a small accident during parking. So this result influences very negatively her confidence, and she believes she will never be able to drive car again. However, we can take the same patient, but her self-confidence or confidence in her driving abilities is very low, but the motivation is different. She wants to become an independent woman. She wants to become independent on her husband. She doesn't like to ask him all the time to drive, and that is why she invests some energy into the preparation. For example, she pays some extra lessons in the driving school. And then, although the driving never will be pleasant for her, but she makes less mistakes, and she finally successfully arrives to the target and to the destination, and with every driving her trust grows, so her confidence into her abilities is bigger and bigger. So how can we influence this cycle of change? Of course, the patient has some blocks that hinder him in making a successful change. For example, he has a lack of self-confidence. There is a history of previous failures, and he may even feel hopeless. And as for the investment often isn't sufficient, because the patient is resigned, or he just doesn't concentrate fully on the present problem. Or during the attempt, he may be paralyzed by fear, or he may be too hurried and make unnecessary mistakes. And as for the result and the impact to the confidence, the patient may exaggerate the negative result and neglect the positive result possible. For example, the patient may be embittered and may generalize that he has a bad luck that hinders him in succeeding in anything, or the patient may feel guilty because of failure. So we can of course use Bach flower essences, as you probably guess. And these essences will be certainly of a big help for the patient. But apart from the essences, you can also, and I highly recommend you to use your communication skills to break, to interrupt this cycle and change it from the cycle of failure to cycle of success. And your task during the consultation is to boost patient's confidence in his resources, or even to help him to become aware of these resources, because often the patient isn't aware that he has any resources at all. Sometimes it's useful to reframe the motivation. Reframing means to changing the interpretation of some fact. For example, a good reframing is to change something from a problem to a challenge, because problem is something most people feel ashamed, guilty, they feel reproaches of conscience, for example. However, challenge is something attractive that can help the person to grow personally and spiritually, for example. And you can appreciate the investment. Of course, as the more the patient invests, the higher the probability of success is. And during the attempt, you can boost the courage of the patient. And finally, you can again reframe the results. Instead of feeling guilty, you can interpret possible failure as an opportunity to learn from experience. So next time you probably will be more successful. And the central theme of the whole process of change, or how to help the patient to change successfully, is the therapeutic relationship. The therapeutic relationship gives some stability for the patient and some confidence that with your help he can succeed. So, thank you very much for watching this video. I hope you have enjoyed it. And in this video we have stayed on a rather theoretical level when we have spoken about change. And in the next video we will explain more practical aspects, what techniques to use, how to help the patient to change successfully.